Maybe you've noticed your pet isn't walking like they should. Their posture is off, or they have difficulty jumping or going up and down stairs. Your four-legged friend could be suffering from a disc disease. Coming up, we'll talk with neurologist Dr. Devon Hague about the causes and treatment options. Stay with us.
It's almost impossible to imagine life without internet today. It keeps us connected to work, school, and loved ones, no matter where they are. Fidium Fiber Internet now serves over 1 million locations, providing reliable, consistent service that keeps these connections strong. From vibrant cities to quiet rural areas, fiber broadband is a key driver of economic growth. Fidium is dedicated to supporting communities and enhancing lives through this essential technology. Learn more at fidiumfiber.com.
At Tender Touch Grooming, we groom dogs of all sizes and breeds tenderly. Our team pampers your furry friend with care, because every pet deserves a tender touch. Appointments are available via text at 217-317-9489.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Once again, the Paw Report is on the road, and we've traveled back to Champaign-Urbana to the University of Illinois Veterinary Teaching Hospital. And today we're joined by Dr. Devon Hague. Thank you so much for joining the program, a first-timer. So as a first-timer, we always put you on the spot and tell us a little about you and your background and your expertise.
Yeah, thank you so much for inviting me to the show. This is really a privilege to be able to share this experience with you. So I did veterinary school at Ohio State University. After finishing my veterinary school degree, I then went on and did a rotating internship and then a specialty internship in neurology and neurosurgery. Those each lasted a year. And then I did a 3-year residency program in neurology and neurosurgery. After completing that, I came here about 12 years ago to restart the neurology service here.
What was your magnet to go into that direction of specialty?
I love puzzles, and so doing a neurologic examination, part of that is to put all of the pieces of the exam components together to figure out where the problem is in a patient. So it's very much doing what we call neurolocalization, or trying to find where the problem is like a puzzle. The other aspects of neurology that I love is that it's not just medical neurology in veterinary medicine. We get to do medical neurology, but we also get to do neurosurgery. And often I found that the clients who have pets that have neurologic diseases, so their pet might be completely normal and then all of a sudden has a seizure, or all of a sudden is paralyzed and can't walk. That can be a really, really stressful situation. And so I really enjoyed the challenge of trying to build that rapport with a client right away and trying to put them at ease by giving them information and being empathetic in the discussion with them about what's going on with their pet, because it is really can be quite scary.
Mm-hmm. Mm-hmm. Well, our discussion today is really centered around disc disease, IVD. So I think the best question to ask as we launch into many others is, what is it, and what disc does it actually involve, or discs?
Yeah. So I brought here a model of a spine, and the discs themselves, in all mammals, we have discs that live in between the vertebrae, and they provide shock absorption normally to the spine itself. The way that we like to think about it, the analogy that gets used a lot, which I think is a good one, is that it's like a jelly donut. So you have the outside dough part of the donut, which we call the annular fibers, and then the inside, that gooey, nice soft material, the inside of that jelly donut or the inside of the disc provides that shock absorption for the spine itself. So then that way people and animals can run and jump, and it allows then the spine and the spinal cord to be safe. So it's intervertebral disc is the IVD, and then we add the extra D, so intervertebral disc disease would be IVDD. And so it's between between the vertebrae, and that's where the discs live.
There's a couple of different classifications for this. Can you explain that?
Yeah, exactly. So what happens with the disease itself, it's a degenerative disease process. So this, over time, chronically, the disc itself will go under degeneration and breakdown. So there's two classifications of the degenerative process. One is called type 1, where the disc material within the middle of the disc, the kind of the jelly part of the jelly donut, will undergo hardening. So instead of being nice and soft, it can become more calcified and harder. And then the other part that can happen is, and this is where we can then see patients present either very quickly, or if it happens slowly, then their symptoms would be more slow, would be that a piece of that disc material that's inside the jelly donut itself, that calcified material, will rupture out, what we call extrude, come out of the disc itself, and it goes upward. And so what's right above it is the spinal cord itself, so it then can cause compression to the spinal cord. So that's the type 1 disc disease that we see. The type 2 disc disease is more where we have thickening of the doughy part, or the annular fibers of the disc itself, and so then there can be protrusion, so that the jelly part of the jelly donut stays inside the disc itself, and we get more protrusion of the disc material, causing pressure to the spinal cord.
Do you see a lot of clients that have these problems? I guess in a larger sense, is it very common in dogs to have this disease?
Yeah, it's estimated to be approximately 2% of dogs. So it's a pretty high percentage, especially when we think about diseases like cranial cruciate ligament tears, which is similar to like ACL in people. That's a very common disease we also see in dogs, and that, I believe, the percentage is only about 1.5 to 2%. So we see it actually quite commonly. It's one of the more common diseases, neurologic diseases, that most general practitioners, small animal veterinarians, and then even ourselves as veterinary neurologists as well.
Pet owners out there watching, might say, well, what are the signs? What should I be looking for? What are the clinical signs that my dog may be suffering from this, or may have this disease?
Yeah, that's a great question. So this is just the back part of the vertebrae here. This is the lumbar spine. I didn't bring the other piece of it. So it really depends on where, because there's discs all the way from the neck all the way down to the base of the tail. So essentially the discs themselves, it depends on which disc is affected and is problematic. So if it's in the neck, then you might see signs related to pain in the neck, or that they have problems walking in all 4 of their limbs, their front legs and the back legs. If the disc problem is more in the middle of the spine, then you might see problems more in the middle of the back, and then the back legs are affected, but the front legs are normal. So as I mentioned, sometimes patients might be painful, and that's the only symptom that they're showing. Other times we might see that they have lost complete movement of their legs, that they are paralyzed. And in the worst case scenario, in addition to being paralyzed and they can't move their legs, if we find that they can't feel their feet as well, that could indicate a more severe injury, and unfortunately, in many cases, a decreased prognosis for them to get better, even with surgical or other interventions.
I was just going to say, what what signs are that it's a very, very severe emergency? You know, when would the alarm bells go off?
Yeah,
probably that.
Yeah, absolutely. If a pet is unable to get up and walk, then we definitely make the recommendation that that pet should be seen by their veterinarian, or if it's after hours or on holidays, you know, that pet should be seen on an emergency basis at an emergency hospital.
So when those pets come in, how are they diagnosed? What is the series of tests, or what does that appointment look like when they come in?
The very first thing that we do is we perform our examination. We try to, as I mentioned before, localize exactly where the problem is. Is it in the neck? Is it in the middle back? Is it in the lower back? And then based on where the problem is, then we would move forward with doing imaging of the spine itself. Ideally, the MRI is the best way for us to be able to look at the soft tissue structures, and we get to see the spinal cord, we can see the discs, and it gives us a really clear picture if there's a structural problem going on. So for example, if we're seeing evidence that there's pressure on the spinal cord itself, we can see that, and that helps us to know what would be the next treatment. Often that might involve surgery and going into surgery at that region.
Can we go into that a little bit as far as the treatment options, medical versus the surgical options? And when I say medical, more, would there be therapeutic? Would there be water, therapy, other exercises at home? And then kind of launch into the surgical aspect of it. I'm sure it's not universal for all, because if it's in the neck versus other parts of the spine, it could be a different surgery that you're performing.
Yeah, absolutely. So typically we will make the recommendation for medical management in situations where the patient's clinical signs are that they are painful, that this was the first time that we've seen this problem, the patient's painful, they're still able to get up and walk. And so it seems very reasonable in that situation for us to move forward with conservative medical management, which would involve pain relieving medications to, of course, help manage that pain. One of the more important parts of the medical management is for us to do strict rest. So I like to think about that analogous to bed rest, because it can be very, very hard to tell a client, go ahead and strictly put your dog into a small confined area or in a crate for 4 to 6 weeks. And that is so hard. Exactly. That's very, very hard. The reason why we recommend that is, again, if you had a similar issue, your physician might be telling you need to be on bed rest for this period of time. The idea behind that is to allow the disc itself, again, if you're thinking about it like a jelly donut where we have this opening in the disc itself, there's more material that could potentially rupture up and hit the spinal cord. So we want to give that disc time to heal over, so then that way we prevent hopefully more disc material from rupturing up. And so that's actually, it's more rest rather than exercise that's going to be really, really important in when we're medically managing these patients. In some cases, if the patient is not up and walking and the family chooses to do medical management rather than surgical intervention, we may recommend things like massage therapy or movement, like range of motion of the legs itself, just to help keep the muscles kind of moving in a way like that. And the other aspect of medical management that I think when we think about a problem in the spinal cord, we immediately think about, well, they can't walk. That's a big issue. But another aspect that we also need to consider is the fact that the very similar nerves that are providing nerve signals to the legs are also innervating or providing that nerve signals to the bladder as well. So sometimes these patients are incontinent and we need to assist them in urinating as well. So
if I'm a pet owner and I decide after consultation with you that surgery is the best option, and you suggest that surgery is the best option in your medical opinion, how will I know as a pet owner if it's successful or not? You know, that's the first, I want my dog to be normal again.
Right, exactly. I mean, that's everybody's goal.
Right,
That's
right.
the pet owner's goal. That's certainly our goal. I like to think about all of this as a team, you know, with the pet owner and with the doctor as well. So if that patient is getting better as far as being able to get up and walk, being able to be continent and use go outside and
Right.
urinate appropriately, if they are without pain, off of pain relieving medications, I mean, all of these would be indications that this was successful. So those would be the really big parameters. And certainly the veterinarian would be the one to help guide and inform, okay, these are symptoms that we're seeing, that there's improvement, and so we're feeling positive about what this overall prognosis is going to be, but there might be other indications that might tell us that, gosh, the prognosis is unfortunately not going to be good in this situation.
What's a time frame for that? What does that look like as far as getting up, going to the bathroom, maybe being a little perkier?
A typical is, you know, there is going to be, what we like to see is at least patients being static or ideally a little bit better every day. We typically, when we have a spinal cord injury, see the most amount of improvement within the first 2 weeks following that injury and surgery. However, if that pet still at that time isn't walking, we're not going to say, oh, they're not going to walk anymore. We want to give them the full 2 months. So usually about 8 weeks is going to give us a good indication of how that pet is going to do.
So always with surgery, there can be complications. And what do you see in some of your clients is their progression and their recovery, you know, moves forward?
Yeah, so it's a great question. Certainly with any type of surgery that we would do, there's always the potential for complications. Thankfully, the complication rate is low, but complications that we talk about with pet owners include if the surgery doesn't go well and the pet remains paralyzed, or if there could be a problem with anesthesia or bleeding. You know, a lot of these complications again are estimated to be, you know, less than 1% of patients. So often surgery itself honestly doesn't carry as much complication as the original injury to the spinal cord itself. So for example, if that disc, especially when we see this extrusion of that disc material, if that disc is causing compression, so I have my spinal cord and the disc is causing compression, I can go in there and remove that disc material and allow the spinal cord to go back into its normal shape. So that is the best type of scenario for us to be successful. The problem is that if that disc material has ruptured up and hit the spinal cord and caused a lot of damage to the spinal cord itself, there's not anything I can do surgically to kind of remove that damage that has already happened when there's that contusion bruising injury. So that's the situation that's always complicated when we have a patient, and we especially see that with the patients that come in that are that might not be, that the surgery itself might not be successful. It's not that the surgery wasn't successful, it was successful in what it was able to do. It's just that spinal cord injury is one in which we can't do anything to reverse the damage that's happened to the spinal cord itself. And those are the trickier cases, because I wish there was something I could do surgically or medically. And in those instances, it's really the having a discussion with the pet owner about, are they able to manage their pet long term in a situation where they might be paralyzed and or incontinent as well.
What causes injuries? I mean, is it something that is genetic? The pet could be predisposed to something like this, or is it as simple as playing too hard, jumping, going up and down steps? I'm sure there's a wide range of reasons why, you know, the disease develops.
Yeah, exactly. And it is in and of itself, when we classify the disease itself, it's considered a degenerative disease because the disc itself, as the pet and the patient is aging, is undergoing degeneration, the same way that, all of our bodies do as we
Right,
get older.
right, exactly.
Now there are particular breeds where we can see this happen earlier. So again, all animals all dogs especially, are predisposed to this degenerative process. But there are certain breeds like Dachshunds, for example. We see this a lot because they undergo an earlier degenerative process to their discs.
What can pet owners do to maybe prevent this? If it's the natural aging process, we can't stop that, obviously.
Yeah, exactly.
But is there anything like with that breed that you specifically mentioned? Is there anything precautions that could be taken?
Yeah, I think the one thing that is always, certainly if your pet is a breed that's predisposed, or certainly if we have a high suspicion based on maybe they had an event of back pain in the past or a problem walking in the past, and so we are assuming, or even if we've done the diagnostics and we've seen that this pet has been confirmed to have this disease process, anything that we can do to prevent kind of vertical up and down activity. So if you think about it, when that pet is jumping off the couch or jumping off the bed, right, all of that force of that spine, right, is coming down, right, on their front legs, and that force is coming through their back itself. So if I have normal discs, it's allowed to provide that normal help to provide the cushion, exactly. But if there's degeneration, then all of that force on the back itself could potentially those forces could lead to them being predisposed to having a disc problem. And it's not necessarily like one time jumping off the bed, it's the wear and tear of constantly doing that. And something I think that we as pet owners sometimes don't think about is if your bed or even your chair, right, is set this high and you have a smaller breed dogs, they're little athletes. And so, if their legs are this long, right, and if I were to stand up in this room and you think about the length of my legs, I have pretty short legs too, but it would be analogous to me jumping on and off the ceiling, right, all of that. And so all of that pressure is, on all the joints and on the back itself. So trying to do things like stairs or ramps and those kinds of things, and not letting them jump off would be ideal. But it's hard. I mean, they have to live their life
and they're
too.
active.
Right, they're active. So it's hard. It can be it's a challenge.
I'm sure you have conversations with pet owners that fear, I have this, or my dog goes through this surgery and is doing well. What happens 3-4 years down the road? Could this happen again?
The recurrence rates of this happening again is after surgery is estimated to be around 15%. So thankfully, the odds are in our favor that this is likely not going to happen again. Of course, I get a bit of a skewed population of patients, so I have definitely seen patients who have had this happen, twice or even 3 times. Thankfully, again, even though I see the skewed population of those patients, it's not common. Yeah.
What about cats? Is it common in cats?
It's not. Cats themselves can undergo this degenerative process of the discs, but we don't see the problems with the extrusion of the discs or of this issue like what we see in dogs. It's quite uncommon in cats. Maybe 1 a year. Versus
Cats,
dogs,
they're always the different animal.
Versus dogs, it's like 1 a day, right? So
if you perform the surgery and you'd mentioned, paralysis may not, the walking ability may not come back. There are options for pet owners. I mean, there are devices that their pets can be adapted to. Have you seen cases where probably the shock of paralysis is hard for a pet owner, but there are other options too?
Absolutely. I mean, I think it's we see a population of pet owners here that are very committed. I mean, people that are coming to see a neurologist, neurosurgeon for care for their pets. So absolutely, we see so many amazing owners they're invested in that. So absolutely, there's wheelchair types of devices. In fact, our rehabilitation service here will do fittings, because it's really, really important to make sure that all of the measurements are correct. And specified to that individual pet. Yeah, so absolutely. And we work with a lot of pet owners, our service, the orthopedic surgery service, the rehabilitation service, to make sure that we're answering all of the questions related to the pet's care, and that we're helping along the way, you know, for certainly for those pet owners who are committed to that.
Well, great way to end the discussion today, Dr. Devon Hague, a first timer on the Paw Report. And of course, we'll have you back because every time a guest hits it out of the park, we invite them back again to the Paw Report. But again, thank you for the information on IVD and disc disease. And of course, if pet owners out there have questions, they can always reach out to the U of I. Thank you.
Thanks so much.
Well, thank you, our viewers, our wonderful viewers of the Paw Report, for joining us for this episode. I'm your host, Kelly Goodwin. Until next time, we'll see you then.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
At Tender Touch Grooming, we groom dogs of all sizes and breeds tenderly. Our team pampers your furry friend with care because every pet deserves a tender touch. Appointments are available via text at 217-317-9489.
It's almost impossible to imagine life without internet today. It keeps us connected to work, school, and loved ones, no matter where they are. Fidium Fiber Internet now serves over 1 million locations, providing reliable, consistent service that keeps these connections strong. From vibrant cities to quiet rural areas, fiber broadband is a key driver of economic growth. Fidium is dedicated to supporting communities and enhancing lives through this essential technology. Learn more at fidiumfiber.com.